Epilepsy does not affect everyone in the same way. And in women, there are a couple of things that we need to understand so that we can optimize their treatment. Now, for example, in childbearing age, where women have started having their menses, it's very, very important to keep in mind that their pill can be affected by the anti-seizure drugs. And this is very important to have a counseling session with them so that they can understand that either we need to use other methods that are better so that it can prevent them from having pregnancies, unwanted pregnancies rather, or we can increase the doses of their pill so that we can prevent pregnancies. And number two, which is very, very important, when women with epilepsy are planning to have babies or they're planning to have a family, it's very important that they discuss this with their doctors, because we understand one of the most important things that can happen is that when they are on some of the drugs, epilepsy drugs, that can affect their unborn child. And therefore, it's very, very important at this point in time we change treatment, which potentially can harm the baby. Or sometimes we need to use the lowest maintenance doses, which means that this can prevent the women or the unborn baby from getting harm from the drugs. And we understand the anxiety that comes in when women with epilepsy are pregnant. But one thing I'd like to say at this point is that 90% of the women with epilepsy will have normal babies and the babies will be normal. So if everything is in place, then it means that these mothers with epilepsy can have normal babies like any other person. But the most important thing to take precaution is to ensure that anti-epileptic drugs that this person is using should continue. Because when you stop anti-epileptic drugs abruptly, then if convulsive seizures happen, then that can affect the child, and therefore that can be dangerous. So it's important that they continue their medication. It's important that they have their clinics regularly because of the risk that sometimes comes with pregnancy. So women with epilepsy should be treated with some caution because of this. When the baby is born, some of the things that needs to be done is to make sure that the baby is safe. Normal breastfeeding can continue. We, of course, understand that sometimes the medicine that the mother with a child with epilepsy is using can be passed to the breast milk, and that can affect the child, but that is not very significant. Maybe some drowsiness, but that will not affect the baby's growth.